4 million Americans are walking around today with an autoimmune disease that is slowly drying them out from the inside, and roughly 9 out of every 10 of them have not been diagnosed. By the time you finish watching this video, several thousand more will join them, and not one of them will know it. They will keep blaming their dry mouth on aging. They will keep blaming their burning eyes on screen time. They will keep buying eye drops that work for 20 minutes and chewing gum that helps until the meeting ends. And the actual mechanism, the one that explains every single one of those symptoms in a single clean sentence, will go on quietly destroying the glands that keep them comfortable year after year until something serious finally forces a real diagnosis. The part nobody explains clearly is this: your dry mouth and your dry eyes are almost never two separate problems. They are one problem in two locations, caused by one underlying mechanism that your standard 15-minute appointment was never designed to catch. You are watching Dr. Laura Chen. What I do on this channel is take the science your primary care doctor doesn't have time to walk you through and translate it into plain language with the specific protocol you can start tonight. If that's what you want more of, hit subscribe and tap like. We are working toward 100,000 of us on one principle. The system makes its money when you stay sick, not when you get well. That is economics, not malice. But it does mean prevention rarely gets the airtime it deserves, so we give it the airtime here. By the end of this video, you will understand exactly what is happening inside the moisture-producing glands of your face, your salivary glands, and your tear glands when they begin to fail. You will know the name of the disease that causes it. You will know the simple home tests that strongly suggest it. You will know the foods that accelerate it, the foods that calm it, and the day-to-day protocol that in most cases returns real moisture, real comfort, and real saliva to your mouth within 4 to 6 weeks. So let me be direct. The thing you have been told, that dry mouth is just aging, that dry eyes are just dry eyes, that your medications are the only reason your tongue sticks to the roof of your mouth at 3 in the morning, is incomplete in a way that matters. Here is the truth. There is a specific autoimmune disease called Sjögren syndrome. You say it like S-H-O-W grins. It was first described back in 1933 by a Swedish physician named Henrik Sjögren, and for nearly 100 years it has been one of the most underdiagnosed autoimmune conditions in medicine. The Sjögren's Foundation estimates 4 million Americans have it. Roughly 9 out of every 10 of them are women. The average age at diagnosis is in the 50s, but the symptoms typically start a full decade earlier, and the average time from first symptom to a correct diagnosis is somewhere between 3 and 5 years. Some people wait 10. And here is the part that should make you sit up. Sjögren's does not just make you uncomfortable. Left untreated, it raises your risk of a specific type of lymphoma by roughly 5 to 16 times the general population. It can inflame your kidneys, it can scar parts of your lungs, it can cause nerve pain that feels exactly like neuropathy from diabetes, and it travels with other autoimmune diseases, lupus, rheumatoid arthritis, thyroid disease, about half the time. So when I say this is not just dry mouth, I mean it is not just dry mouth. That is the whole point of this video. The symptom is the moisture, the disease is the immune system, and the fix is not another bottle of eye drops. Let me walk you through what is actually happening inside your face. You have 2 main sets of moisture factories. The first set is your salivary glands, and you have 3 pairs of them. The parotid glands sit just in front of and below your ears. The submandibular glands sit under the floor of your mouth, tucked along the inside edge of your jawline, and the sublingual glands sit directly under your tongue. Together, on a normal day, they produce somewhere between 1.5 and 2 liters of saliva. That is a remarkable amount of fluid coming out of glands you have probably never thought about in your life. The second set is your lacrimal glands, your tear glands. They sit just above and slightly to the outside of each eyeball, hidden up behind the bone of your eye socket. They produce a continuous, thin film of tear fluid that does 3 jobs at once. It cleans the surface of your eye, It feeds the cornea, which has no blood supply of its own and depends entirely on tears for its oxygen and nutrients, and it acts like windshield wiper fluid every time you blink. Both sets of glands have one thing in common. They are made of small, delicate cells called acinar cells. These are the workers. They are the bakers in the bakery. Their entire job is to produce moisture on demand. Now, here is the analogy I want you to hold in your head for the rest of this video. Imagine a small, well-staffed bakery that runs 24 hours a day. The bakers, the acinar cells, produce tears, saliva, even the moisture inside your nose and your private regions. Now imagine the bakery hires a new security firm. And the security firm, somewhere in its training manual, gets the word baker confused with the word intruder. The guards start escorting the bakers out of the building. Some get fired. Some get hurt. Most of them never come back. The oven's cool. The bakery still has the building. The bakery still has the equipment, but there is nobody left inside to bake. That is Sjögren syndrome. Your immune system, specifically a type of white blood cell called a lymphocyte, invades the glandular tissue and gradually destroys the moisture-producing cells. It is not a quick attack. It is slow, year over year, gland by gland. And by the time your mouth feels dry enough that you notice it most of the time, somewhere between 40 and 70% of your gland tissue is already gone. This is why every year you wait, every year you assume it is your blood pressure pill, your antihistamine, your antidepressant, or simply the calendar, the damaged compounds in tissue that does not regenerate easily. Before I go further, I want you to stop and pay attention. There are specific signs that mean you do not finish this video, you do not order another bottle of artificial tears, you call your doctor today and ask for an autoimmune workup. The first is a sudden, painless swelling of the glands in front of your ears or under your jaw, particularly if it does not go down within a few weeks. That can be a sign the inflammation has progressed into something more serious, and it needs imaging. The second is unexplained joint pain that travels knees 1 week, hands the next, shoulders the week after, particularly if your fingers feel stiff for more than half an hour in the morning. That is the pattern of inflammatory arthritis, and Sjögren's runs alongside it. The third is unexplained numbness, burning, or pins and needles in your hands or feet that is not from diabetes. Sjögren's related nerve damage is real, and it is treatable when caught. And the fourth, pay close attention to this one, is a persistent dry cough that produces nothing, combined with shortness of breath when you walk upstairs. Sjögren's can inflame the small airways and the lung tissue itself, and that complication needs a pulmonologist, not a cough drop. If any of those four are present in your case, finish this video, then call. Do not wait. There are essentially 3 patterns of presentation, and I want you to listen for which one sounds like you. The first pattern is what doctors call primary Sjögren's. The dry mouth and dry eyes show up on their own, often gradually, often blamed on aging or medications. Blood work eventually shows specific antibodies, most commonly something called anti-SSA, sometimes called anti-Rho. About 60 to 70% of people with Sjögren's test positive for it. The other 30 to 40% test negative on the blood work, but a careful lip biopsy taking a very small sample from inside the lower lip shows the immune cells inside the glands. This is why so many people get told their blood work is normal when the disease is in fact present. The blood test misses a meaningful slice of patients. The second pattern is secondary Sjögren's. This is when the dry symptoms ride along with another autoimmune disease, lupus, rheumatoid arthritis, scleroderma, or thyroid disease. If you already carry one of those diagnoses and the dryness is new or worsening, that is a flag. Roughly 30% of people with rheumatoid arthritis and somewhere between 5 and 20% of people with lupus also have Sjögren's. It hides behind the bigger diagnosis. The third pattern, and this is the one that fools most clinicians, is what I will call mimic Sjögren's. The symptoms are real, the dryness is severe, the exhaustion is debilitating. But the antibodies do not show up, and nobody pushes for a lip biopsy or a salivary flow test. The patient gets told it is aging, anxiety, or medication side effects. The disease keeps progressing, while everyone looks the other way. Listen for your pattern. It will matter when you talk to your doctor. Picture a woman I'll call Margaret, 64 years old, retired school teacher, sharp, organized, 3 grandkids. For about 6 years, she had been telling everyone, her husband, her primary care doctor, her dentist, that her mouth felt like sandpaper at night. The dentist said it was probably her blood pressure medication. He gave her a prescription rinse and recommended sugar-free lozenges. Her primary care doctor agreed it was probably the medication, then added the allergy pill she took in spring. Her eye doctor told her she had something called dry eye syndrome and prescribed a more expensive drop. By the time she walked into a rheumatologist's office, she had been carrying a water bottle with her everywhere for 3 years. She had stopped going to the movies because she could not get through a film without her contact lenses feeling like they were being scraped across glass. She had 3 cavities in 18 months, in a mouth that had been cavity-free for 2 decades. And her tongue had developed a smooth, slightly cracked appearance that her dentist had quietly assumed was just dry mouth. The rheumatologist asked her 3 questions nobody else had asked. Did her joints ever feel stiff in the morning? Yes, her hands, actually, but she had blamed that on gardening. Had she noticed her saliva feeling thick or stringy rather than just absent? Yes, and she had assumed that was the prescription rinse the dentist had given her. And had she ever, in the last few years, gone through a period of intense, unexplained fatigue that did not improve with rest? Yes. For about 8 months, 2 summers ago, the blood work came back positive for anti-SSA. The Sjögren test, a small strip of paper tucked under her lower eyelid for 5 minutes, showed she was producing less than 2 millimeters of tears in that time, where a healthy person produces 10 or more. A salivary flow test confirmed the saliva side. The diagnosis was Sjögren syndrome. She had been living with it almost certainly for more than a decade. We will come back to Margaret in a few minutes. She did very well. Now, let me close the loop on the mechanism, because I want you to understand exactly why your symptoms feel the way they feel. Go back to the bakery. The acinar cells, the bakers, are gone or reduced, but the ducts leading from the gland to the surface of your eye or the inside of your mouth are still there. Those ducts are like the pipes that lead from the bakery's loading dock to the customer. Pipes without product are still pipes. So when you eat a cracker, your salivary ducts try to deliver, but only a thin trickle comes through because there is nothing left to deliver. When you wake up in the morning, your tear ducts try to lubricate, but the film is so thin that your eyelid drags across the cornea like dry tissue paper. That is why eye drops work for 20 minutes and then stop. You are loading the pipe from the outside. You are not making the bakery produce more bread. To do that, you have to call the security firm off. You have to settle the immune attack. And while you cannot reverse the cells that are already gone, that is the truth, and I am not going to lie to you about it, you can usually preserve the cells that remain, and you can usually wake up the partially damaged ones. In most patients, that produces a real, measurable improvement in moisture within 4 to 6 weeks. There are 2 things you can do at home right now to get a much better sense of whether this is your situation. The first test is the cracker test. Take a plain, dry cracker, a saltine works perfectly. Put it in your mouth and try to chew and swallow it without taking a sip of water. Time yourself. A person with normal saliva production can usually chew and swallow a dry saltine within about 1 minute comfortably. A person with Sjögren's type dryness will typically need water before they can swallow it at all. If you cannot get a dry cracker down without water, that is a meaningful finding. The second test is the morning eyelid test. The first thing tomorrow morning, before you put any drops in, before you splash water on your face, look in the mirror and slowly close and open your eyelids 10 times. A healthy eye will feel slick. The eyelid will glide. A Sjögren's affected eye will feel scratchy, slightly sticky, or as though the eyelid is dragging across the eyeball. If you feel that drag, write it down. It is not normal. It is not aging eyes. It is dryness severe enough to feel. Neither of these tests diagnoses anything on their own, but if both are positive in your case, you should be having a different conversation with your doctor than the one you have probably been having. Now let me give you the 3 foods and habits that are making this worse, day in and day out, in almost every case described in the literature. The first one is alcohol, and here I mean even modest amounts, particularly in the evening. Alcohol is a diuretic, which means it pulls water out of your tissues, but more importantly, it inflames the same glands you are trying to protect. A single glass of wine in the evening will measurably reduce your overnight saliva production. For someone who already has limited gland function, that small reduction is the difference between sleeping comfortably and waking up at 3 in the morning with your tongue stuck to the roof of your mouth. If you have any of the symptoms I have described, you should be looking at alcohol as something you do not drink daily. The second one is caffeine taken late. Coffee, tea, and most sodas are mild diuretics, but more importantly, they overstimulate the sympathetic nervous system, the same system that, when active, suppresses saliva flow. Sympathetic dominance is dry mouth dominance. If you drink coffee after about 2 in the afternoon, you are running your sympathetic nervous system on high through the very hours your body is supposed to be rehydrating its glands. Move it earlier. Or cut it back. Within a week of moving caffeine before noon, most people notice a small but real difference in evening dryness. The third one is processed sugar, and I mean specifically the snack bar, granola bar, dried fruit, candy kind. There are two reasons. The first is that sugar feeds the bacteria in a dry mouth, and a dry mouth has none of the natural antimicrobial flow that washes them away. So sugar in a dry mouth becomes cavities very quickly. Margaret's 3 cavities in 18 months were a textbook example. The second is that high blood sugar itself is dehydrating. Every spike pulls water out of your tissues into your bloodstream. People with Sjögren-style dryness who eat a high-sugar diet tend to feel substantially drier within about 30 to 90 minutes after the snack. Pull these 3 out, just those 3, and watch what happens in 2 weeks. Now the other side. 3 foods and habits that genuinely help. The first is plain cool water, but the way you drink it matters. Most people with dry mouth take a few big gulps a few times a day. That actually does not work very well. What works much better is small sips, frequently every 15 to 20 minutes, all day, a few sips at a time. The reason is that the glands respond to sustained mild moisture, not to flooding. Keep a glass or a bottle within arm's reach at every chair you sit in. You should be finishing roughly 8 to 10 of those small sips per hour during the day. The second is omega-3 rich foods. Fatty fish, salmon, sardines, mackerel 3 to 4 times per week. Or if fish is not on your menu, ground flaxseed 2 tablespoons per day stirred into yogurt or oatmeal. Omega-3 fatty acids reduce the inflammatory signals coming from your immune cells, and research published in journals like Cornea and the Ocular Surface has shown measurable improvements in dry eye symptoms in patients who took omega-3 for 12 weeks. This is one of the few dietary interventions with consistent published evidence behind it. The third is something most people do not think of: sugar-free xylitol gum or lozenges, chewed or dissolved several times per day. Xylitol is a sugar alcohol that does not feed cavity bacteria, and the act of chewing itself stimulates whatever salivary tissue you still have. The same goes for hard sugar-free candy. 5 or 6 times a day, between meals, dissolve 1 in your mouth. You are doing 2 jobs at once, physically stimulating the gland and protecting your teeth from the cavities that come with dry mouth. Here is the full protocol. I am going to give you a day, hour by hour, the way I would lay it out for someone who walked into my office tomorrow. None of this replaces your doctor. All of it is safe for most adults to start tonight. Morning. Before you get out of bed, swish a small mouthful of lukewarm water for about 30 seconds and swallow. This loosens any film that has formed overnight. Then, sitting up, put 1 drop of preservative-free artificial tears in each eye and blink slowly 20 times. Get up. Brush your teeth using a high fluoride toothpaste. Your dentist can prescribe one with 5,000 parts per million, the version designed for people with dry mouth. Eat breakfast, eggs, oatmeal, sardines, plain yogurt, berries. Avoid juice. Drink water with the meal, not after it. If you take coffee, take it now, not at noon and not in the afternoon. Daytime. A glass of water at your seat at all times. Small sips every 15 to 20 minutes. 1 sugar-free lozenge or 1 piece of xylitol gum every 2 hours. If your eyes start to feel scratchy, 1 drop of preservative-free artificial tears, but try not to depend on more than 4 or 5 doses a day. because overusing them can actually worsen the surface of the eye. Lunch should include a vegetable, a protein, and a healthy fat. If you cannot get fish 3 times a week, discuss with your doctor whether a quality omega-3 supplement is right for you, typically about 2,000 milligrams of combined EPA and DHA per day with food. Evening, no alcohol on a working week. No more than 1 glass on a weekend, with food, not on an empty stomach. Dinner before 7 if you can manage it. After dinner, no more snacks, particularly nothing sweet. Brush and floss carefully, use a fluoride, rinse your dentist will recommend the right one. If your dentist has not yet been told about your dry mouth, tell them tomorrow. Before bed. This is the most important hour of the day for someone with this condition. Run a humidifier in the bedroom, particularly in winter, when indoor air can drop below 30% humidity, which is brutal for dry eyes and dry mouth. Apply a small amount of lubricating eye gel, not drops, gel to each eye. It will blur your vision for the night, but it will keep the cornea protected for the 8 or 9 hours your eyelids are closed and not blinking. Set a glass of water on your nightstand for the inevitable sip in the night. And consider sleeping with the head of the bed slightly elevated, a single pillow under the mattress at the head, which reduces nighttime gland congestion. That is the protocol. Done every day for 4 to 6 weeks, most people see a real, measurable improvement in symptoms. Not a cure, let me be honest with you. This disease is not curable today, but a real, livable improvement. Margaret started the protocol the week after her rheumatologist's appointment. Her doctor also started her on a prescription medication called hydroxychloroquine, which is the first-line systemic treatment, plus a prescription medication called pilocarpine, which stimulates whatever salivary tissue remains. Discuss any prescription decisions with whoever manages your care. They have their own considerations, and they are not the right fit for everyone. Within 2 weeks, she could chew a saltine and swallow it without water. By 6 weeks, her morning eye dragging was gone. By 12 weeks, her saliva, while not normal, was sufficient for her to sleep through the night without waking up to sip water. Her cavity rate over the following year was 0. She did not need to retire from her grandchildren's lives. She did not need to give up movies. Her case is not unusual. It is in fact what happens when this disease is finally identified and the protocol is applied with discipline. Before we close, here is what I want you to do in the next 12 hours. 5 things. 1. Do the cracker test tonight. Write down the result. 2. Tomorrow morning, do the eyelid drag test before you put anything in your eyes. Write down the result. 3. Move your last caffeine to before noon, starting tomorrow. 4. Pick up a bag of xylitol lozenges or xylitol gum the next time you are at the pharmacy. Start carrying them with you. 5. Call your doctor's office this week and ask, specifically for an autoimmune panel that includes anti-SSA, anti-SSB, ANA, and rheumatoid factor. Tell them you have persistent dry mouth and dry eyes, and you would like to be evaluated for Sjögren's syndrome. Use the name, use the word. Doctors respond to specifics. Those 5 things, started tonight, change the trajectory. Now I want to know who is watching. How old are you and what state are you watching from? Tell me both in the comments below. Because after age 55, the autoimmune patterns I just described accelerate noticeably, and the data on Sjögren's especially clusters in the late 50s and 60s. And the state matters too. The dry air states, the desert states, Arizona, Nevada, New Mexico, West Texas, dry parts of Colorado and California, make every one of these symptoms harder to live with. I read every age and every state that gets posted, and it shapes how I write the next video. So tell me your age, tell me your state, and tell me which of the symptoms, dry mouth, dry eyes, dragging eyelids, the cracker test felt familiar. Let me leave you with this. Your mouth is not just aging. Your eyes are not just tired. Your medications are not the whole story. There is a specific disease with a specific name, with specific tests, and with a specific protocol, and you have just been walked through all 4. Nobody at your next appointment is going to walk you through this. So you have to walk yourself. This is general health education, not medical advice for your particular case. Bring what you have learned here to a clinician who knows you and let them confirm the picture. The most useful medicine is the kind you learn to apply yourself. I'm Dr. Laura Chen. Take care of yourself.